Dr. Mohit Kumar Arora, currently practicing in Department of Orthopedics in Narayana Super Speciality Hospital, Gurugram. Today in this video, I'll be talking about backache in children. Pediatric backache, meaning backache in children, is more common than earlier thought. So let's discuss some of the common causes of pediatric backache. First, muscular spasm. It usually occurs in children having core muscle weakness, hamstring tightness, or faulty postures, which can be easily treated with core muscle strengthening exercises, hamstring stretching exercises, and uh, giving them proper postural training. Now, if the pain persists for more than 7 to 10 days, then these children need to see a pediatric orthopedic surgeon for further evaluation and workup. The next cause is post-traumatic injury. As we all know that a lot of children are taking up sports in schools and colleges, hence the incidence of post-traumatic injuries have increased considerably. The post-traumatic injury usually include muscular strain of spinal muscles and sometimes fracture. But all these injuries can usually be managed with bed rest and some analgesics. However, one condition that needs special mention is spondylolysis, which is a stress fracture of the pars interarticularis present in the vertebra of our body. This happens because of repetitive injury or overuse. It usually happens in children involved in contact sports or weightlifting. If diagnosed and treated early, it does not worsen. The treatment usually consists of brace, core strengthening exercises, and some analgesics. The next cause of pediatric backache is disc. Yes, the disc prolapse is more common in adults, however, sometimes it happens in children in their late years. The clinical presentation is the same as that of adults. The child will complain of pain in the lower back with radiation to either lower limbs. The child will come the limp while walking, or parents might notice the limp. The child might complain of motor weakness or numbness in either of the lower limb depending on the severity of the disc involved. Sometimes there may be bladder or bowel involvement, meaning there might be difficulty in urination or defecation. The other cause of pediatric backache is pediatric spine deformities. So notably, the two deformities are very common during childhood. One is adolescent idiopathic scoliosis, where the spine is twisted and bent sideways, and the other one is Scheuermann's kyphosis, where the spine is bent forward. Usually these deformities need only observation and constant supervision. However, sometimes if they progress, then the child might need brace or some kind of surgical intervention. The other cause is infection. Infection in spine is usually not that common as compared to other parts of the body. However, if it happens, it can lead to weakness of all the 4 limbs. So this needs to be treated on an urgent basis. The child might present with fever and he will need antibiotics or hospital admission. The less common causes are juvenile onset ankylosing spondylitis, in which the child complains of pain in his lower back, which is worse in the morning but improves as the day progresses. Then there are some conditions known as tumors of the spine, wherein the child might present with fever, weight loss, loss of appetite, or sometimes swelling at the back. These condition needs proper clinical examination, hematological and radiological workup to rule out the tumor present in the spine. What I have seen is patients with pediatric backache usually have low calcium and vitamin D levels. So it is always advisable to treat vitamin D and calcium deficiencies in these patients. Otherwise, the management overall in majority of the cases needs spine strengthening exercises. I hope I have given you a bit of awareness regarding the pediatric backache in this video. Thank you.